Dr. Nass, let me follow up because there was a second question there, and since you gave us a failing grade, by the way, we're not going to forget you guys for giving us a failing grade here in the media, but let me follow up with Dr. Mills. What can we do as news organizations to better inform the public, to make it an honest debate, so that those people who have questions on both sides of the topic can get their questions answered as fully and as completely as possible? What are we missing? What are we not doing well?
Oh, I think you're doing a great job actually tonight in having this kind of forum, and I applaud you for that actually. So, but I think it's, I think it is important, especially in this day of the internet and so much information that we have access to, as well as so much misinformation, that one of the biggest challenges I think I've seen, and I think this is really the biggest challenge with vaccines in the last 20 years, is how do we help people decipher, how do we all decipher misinformation from information, credible sources, credible information from non-credible. And, I'm sorry, Meryl, but I just do not believe in a vast conspiracy of the manufacturers taking over and this conspiracy. I know a number of people who served in government roles in public health, like myself. And many of us go into academia, as I am at the University of New England. Others go to work for nonprofit organizations. Others go to, other universities or into healthcare systems. And yes, a few might go into industry to work with the industry, including Dr. Gerberding, who went to. But they're not, But I mean, she's the only former government, former CDC director I know of who's gone, who is now working at a pharmaceutical company. And I don't think that makes, I don't think that in itself makes a big conspiracy. And the CDC Foundation has hundreds of donors. And there are firewalls between the CDC Foundation, which helps it to further its work, and the CDC itself. There are separate boards and the like. So, we have underfunded the CDC for years, so this is the U.S. CDC. And so there are foundations where people, and another funder of the major funder of the U.S. CDC Foundation is the Robert Wood Johnson Foundation, as an example.
Johnson & Johnson.
So, Robert Wood Johnson Foundation is very separate from Johnson & Johnson. So, so I think that I do not believe there is this vast conspiracy, particularly when you have places like Duke and Johns Hopkins and Vanderbilt and the NIH and the FDA and Kaiser Health Systems and all of these private-public organizations working together to ensure the safety of our vaccine supply. And the statistics, I think, show for itself that we have diseases that we've never seen in decades in the United States because of vaccines, and we have a lot of diseases that we rarely see because of vaccines.
Okay, and just for about the last remaining 20 minutes, if the panelists in the audience would pretend that I'm in charge for the rest of the night, I would appreciate it. So if we can keep our answers just a little shorter so we can get as many people in as possible. I know you have a comment, Ms. Taylor, if you'd like to join in.
I'd like to eventually answer the anti-vaccine charge, but one of the things that very few people are aware of is that the Department of Health and Human Services actually is a vaccine maker. They hold vaccine patents. So, for example, the Gardasil vaccine, NIH owns the patent on that, so every time Merck sells a dose of it, NIH gets a payment. Now, that's a problem because that's one department of HHS that's getting paid. Another department, FDA, is regulating that vaccine. CDC is recommending that vaccine. And HRSA is the vaccine court that's judging whether or not it's causing damage. So these extreme conflicts of interest that should never be in the first place are there because of the liability protection, and that needs to end.
We're back to our live audience. Please tell us who you are, where you live, and what is your question?
Hello, I'm Becky Whedon, and I live in Wilton. I have two very brief questions that should have brief answers. The first, I want to say that most of the people that I know who use exemptions, their children are partially vaccinated, in fact, usually mostly vaccinated. I'm one of those people. I'd like to know, when you look at that 4% that use exemptions, how many are actually 100% vaccinated that are really contributing to a decline in the herd immunity that you're all looking for? So what is the percent that are 100% unvaccinated? That's my question. My second question is, what were the numbers with the hepatitis B before the introduction of that vaccine? Because from what I can see in Maine, there was not a whole lot of evidence that it would imply we need to vaccinate children on their first day of birth.
Dr. Flanagan, I want to bring back into the conversation. So when we look at those various vaccinations, and there are exemptions, of the 91,000 nationwide or the 600 and change here in Maine, are those people that generally are not having any vaccinations, or are they maybe not having one or two?
The surveys that are done are, is your child completely vaccinated? So have you had X number of vaccines by the time the child is 36 months of age? Have you had X number of vaccines before your child reaches 7 years of age? I'm very proud to say that Maine Care, the Office of Maine Care Services and DHHS has worked very hard to bring our vaccine rate up. And so while you look at national numbers for 2012, what you don't see are the state numbers for 13 and 14, where we've actually been recognized and received 4 national awards in the past year because we've been able to identify those people who were not completely vaccinated. Families were willing to complete the vaccine series, likely didn't know that they were not up to date, and we were able to get them where they're fully up to date. There are families who don't want to do any vaccinations. Many times it's medical. You read the numbers. It's medical, very little religious, and a lot of personal preference. That group, are we having an honest discussion with them? Are they understanding both sides of the issue with as little emotion involvement as possible? Objectively, are we looking at it? Are providers explaining it well? Are we able to respond to the information that they're getting off the internet? That's when we can impact that number and get to an honest number.
Dr. Flanagan, it's my understanding that we do not know what percent of that 4% of children get vaccine exemptions. The data that you're talking about sounds like surveys on vaccine rates, but I'm talking about the actual exemptions that we're all talking about as being a problem, and that we're trying to remove the rights of parents. And what I want to know, is there really a problem, or are we needlessly putting policy on families that doesn't need to be there?
I don't think we know fully the answer to that, because I believe that data, as you know, is reported from the schools, and it's about children who have not, whose parents have asked for a philosophical exemption for the school-required vaccines, of which there are several, but not the full vaccine schedule. So, but to be honest with you, I'm not sure whether did they ask for the philosophical exemption for all of the school-required vaccines, or just 1 or 2 of them. I'm not sure.
I want to bring Ms. Taylor back in the conversation. I recognize the information may be anecdotal, but is there, or are there, maybe 1 or 2 vaccinations that seem to be more problematic for parents who request exemptions than others? And if so, do you know what they are, or can you give us some sense?
Well, there's a couple things. There are vaccines that carry higher risk, and there are vaccines that parents just don't think are that important. On the low end of it, rotavirus vaccine and chickenpox vaccine, parents do not see these serious threats, and because they have adverse outcomes, in some cases, opt out. On the research side of it, the MMR, the DTaP vaccine, and the hepatitis B and the Gardasil vaccine, the HPV vaccine, are the 4 that parents are really having a lot of reported serious adverse outcomes, deaths and brain damage, coma. And those are the ones that parents are not satisfied with the safety research on. Older vaccines like polio, inactivated polio that we've had for a long time, those aren't really controversial. So it's again, different diseases, different risks.
And Dr. Nash, you wanted to add a comment?
Yeah, the latest number I saw was that of the percentage of children who have no vaccines is 0.6%. I also wanted everybody to be aware that the AMA, the American Medical Association, has a code of medical ethics, and in it reserves for doctors medical, religious, and philosophical exemptions. So the National Doctors Group thinks doctors deserve all those exemptions. And I think we've sort of created a false dichotomy tonight, as if I'm against vaccines. I mean, I think everybody who wants a vaccine can have any vaccine they want at any time they want it. The issue is that when you're a doctor, what you're supposed to be doing is, for every individual patient in front of you, making a risk-benefit assessment for what is the best intervention, yes or no, and that goes for vaccines. So if this person has a history that suggests the risk is going to be greater than the benefit, why should they be forced to have a vaccine? I mean, I don't force them to take an aspirin or to take an antibiotic if they don't want to. And several of the vaccines on the vaccine schedule are not even for diseases that are transmitted from one child to the other during the course of normal child activities. For example, HPV. If these kids aren't having sex together, or wet kissing, they are not going to transmit that.
But that's not a required vaccine
Okay, but
for schools.
It's recommended by CDC, and
Recommended,
70% of girls have gotten it, and now there's a new 9-valent vaccine, and now almost,
but
many
you're talking
boys
about
are getting it.
requirements versus
Okay, so
philosophical exemptions, and that's not a required vaccine.
Okay. Meningitis
but I think
vaccine there's a bill in Maine to make the meningitis vaccine required, mandated, and it turns out that only 2% of the meningitis cases are actually transmitted person to person. You may not be aware that 10% of us harbor the meningitis bacteria in the back of our throats or up our nose, and 98% of the cases are due to pre-existing carriage of that bacteria.
I'm very aware of that, but that vaccine is also very effective. And in terms of people who've had children with meningococcal disease would tell you that that is a very deadly illness, and many children with that do die from that when they get it. So I think what we're talking about, though, what we were talking about to begin with was philosophical exemptions versus medical exemptions. And one of the big issues to me is that on some of the school forms that we see, it's actually easier to check off, I choose to not vaccinate my child, than it is to get your child vaccinated. So one of the school forms I saw, for instance, several years ago, and this is a common one used, right on the first page is a big box, and if you check that, that means you're asking for a philosophical exemption. To vaccinate your child, you have to take them to a healthcare provider and fill out the back side of it with all the different vaccine information. So the forms in our schools in Maine actually very oftentimes make it easier to check the box. And I remember when my own children were entering school, and I thought, well, gee, the easiest thing for me to do is just check the box and say, I'll get a philosophical exemption. I don't feel like vaccinating my kids today. And I did go and get the information, and my children were already vaccinated. But the easier thing, if I was busy and everything, was to say, I'll just check the box. So it shouldn't be easier to check a box that I don't want to give you the information, I don't care about having my child vaccinated, than it is to get your child vaccinated.
And just so people have an understanding of what larger problem we're talking about, according to the Centers for Disease Control for the year 2013, of the 113 leading causes of death in America across all ages, there are 4 ailments for which people typically would be vaccinated that were registered or among the 113 leading causes. Most of those 4 were near the bottom. I'll share with you, there were almost 3,700 influenza deaths, 59 meningococcal infection, 12 deaths from whooping cough, and 0 from measles. So regardless of what side of the debate the public is on, the good news is not many people are dying from those, which we should be happy about, regardless of where we are on this discussion.
The vaccines are working. Yes, the vaccines are working.
Let's go back to our live audience. Please tell us who you are, where you live, and what is your question?
My name is Karen Alfano, and I'm from Brownfield, Maine. My question is there any way, I definitely believe in vaccine-injured children. I've seen too many of them. But is there any way that we could change the amount of vaccines that the children get, like started at maybe age 2, and when their bodies have had time to develop and their brains have had time to develop, and then gently give the vaccines? Wouldn't that reduce some of the damage that we see?
Actually, there's research on that. There's a few small studies that have shown one by a practice by a doctor by the name of Elizabeth Mumford, and she was a UVA professor, started a practice, and she published a year or so ago that she uses an alternative schedule. She vaccinates for all diseases, and along with kind of other less aggressive health, medication practices, she has, out of 300 cases, she should have 5 or 6 autism cases. She has none. So we have samples where, yes, less aggressively vaccinated children, we're not seeing the same kind of neurological illnesses, but again, largely anecdotal. We want that research. They're not doing it. What parents are doing is they're doing alternative schedules. They're doing it less aggressive. We are the most aggressively vaccinating country on the earth. Canada and UK has no vaccine mandates at all, but they vaccinate at the same rate for the same diseases. So a lot of these mandates are unnecessary because people have kind of made up their mind whether they will or they won't. But we have families that do, one of the things that families do is titers testing. This differs with different vaccines, but you can get one shot, and roughly 90% of the kids who are going to develop an immunity to that disease through the vaccine will do it after the first shot. So you can just go in and get a blood test to say, does my child need boosters? You can get one shot at a time, and by the time the child enters school, if you've done titers, you've vaccinated much less aggressively, and you have the added benefit of actually knowing which vaccines they properly responded to and which their body didn't, and they may need to be protection for. So yes, there are much safer vaccine practices, and we're just not putting them in because it's safer to do. It's less cost. It doesn't cost as much to do a one-size-fits-all program, and that's what parents are rejecting.